Hello everyone, happy evening. I hope and I believe all of you are doing well. Welcome back to another session for our INI-CET recall where we are going to discuss the radiology questions, dedicated radiology questions. There are around 11 questions that we are going to discuss. We have already done a quick first impression analysis of the INI-CET May 24 exam. So let's discuss the radiology questions, and the questions were a bit tricky. They were not like straightforward questions. Few questions were straightforward, like achalasia was straightforward. EDH and other chest X-ray question were integrated questions. So we are going to discuss all of that. Okay. Yeah, definitely your drug of choice. So I'll tell you about the topic as we are discussing the questions. Okay. Any queries before we start the discussion? A question about Beck's triad. That was the Beck's cognitive theory that was asked, not the Beck's triad per se. Thank you so much, Shabna. And thank you so much, Darshan. Thank you so much. Yes, thank you, R. And yes, one shall be doing that soon. Today, I'll give you an update on that. Okay, yeah. So let's start with the discussion. Disclaimer here that this is all recall based, so there might be a few changes here and there. Please let me know if you remember anything else and where I have missed some options which we could not recall. So please let me know. Okay. Yeah. So first question here, a patient with a history of stab injury to the chest and a supine x-ray was given and the diagnosis was asked. So the options were right hemothorax, diaphragmatic rupture, pulmonary contusion, and what was the other option there? Yes. Now see, understand the concept here. Was it pneumothorax which was given in the option? It was pneumothorax. Okay, so I'll add it on here, the right pneumothorax. Okay, the right pneumothorax. Now understand the concept here, guys. Remember, every time in your image based questions, ruling out the options is very, very important. If it would have been pneumothorax, pneumo air is black on x-ray. So this is not black, this is white, and that is why pneumothorax is out. Okay, pneumothorax is out. Another important point here, it's a supine x-ray. So think logically. Now imagine you have a bottle which is filled with water and you take it supine. I mean, you lie it down. So what will happen? All the water will come as one level, and then when you take the x-ray, how will you see the water? Entire water will be there over that right side of the chest, and that is why that side of the chest entirely will appear white. So unlike your classical appearance that we say, which will have a curve like a pleural effusion, hemothorax is basically like pleural effusion with blood. In a patient of trauma, pleural effusion taken as hemothorax. The confirmatory test is when you see the blood actually when you aspirate it. Okay, it was given in the question, it is supine x-ray. Tamanna, it was mentioned in the question. Okay, nice. So, right. So, logically thinking here, when you see the right hemithorax, which is white, remember this is going to be the answer of right hemothorax. I hope all of you at least know that pleural effusion causes white out hemithorax, right? So if not all of this concept, at least you could have thought that कि white out दिख रहा है. So causes of white out hemithorax, you have collapse, consolidation, pleural effusion. Pleural effusion in this patient of trauma is hemothorax. Okay, that is hemothorax. So this is going to be hemothorax for sure. Okay, this is going to be hemothorax. The test here was basically of the concept that in a supine x-ray, the hemothorax, the blood will spread along the entire hemithorax and give that white appearance. Okay, give that white appearance. Okay, right. Going to the next one, supine was the most important thing there. I think this has become the favorite in all the exams. NEET PG last year asked you to count the ribs. Even FMG exam, it has been there. INI-CET exam, it was there the last time also. Counting of the ribs, knowing the ribs on the chest x-ray, very, very important. Okay. So the arrow is pointing to which of the following. So definitely this is not the pulmonary artery. At least one option is out. This is not pulmonary artery. This is where you have the right descending pulmonary artery, and the central, the main pulmonary artery comes on the left side. So pulmonary artery is definitely out. Costal cartilage, think logically, we cannot see cartilage on X-ray until and unless it is calcified. Right? So posterior rib hai ki anterior rib hai, the concept goes, we have discussed this in LRR also, I believe, counting of the ribs. That is anterior and posterior end. Basically same hi hai dono. Okay? So remember that the rib which has the horizontal part is the posterior part and the oblique one is the anterior part. That is how the rib goes. Posteriorly it is connected to vertebra, then it comes horizontal and then it comes oblique. Anterior ribs do not reach till the midline because they articulate here with the costal cartilage, which cannot be seen on the X-ray. Right? So remember that this part which you see is the flat part, this is the posterior, and these one which you see which are oblique, these are the anterior ribs. Okay, these are the anterior ends of the ribs and these one are the posterior ends of the ribs. That is how you identify the posterior and the anterior. So remember, this is going to be posterior. Okay, this is going to be posterior. Okay? Yes. Going to the next one. Mount Fuji sign is seen in, right? Mount Fuji sign is seen in tension pneumocephalus. We have discussed this in our radiology videos on PrepLadder also. Okay. So, right, I'll come to your queries, guys, don't worry. So, Mount Fuji sign is seen in tension pneumocephalus. Pneumo is air, cephalus means in the cephalic cavity, in the cranial cavity. So, look at this one. The black on the X-ray on CT is air. This is the air in the cranial cavity. This is pneumocephalus. So, look at this appearance here, like this Mount Fuji appearance. So, remember, this is Mount Fuji sign, which is tension pneumocephalus. Mount Fuji sign is tension pneumocephalus. Okay, clear with everyone? So logically thinking, you read pneumothorax so commonly, you read the pneumoperitoneum so commonly, you do not read about Mount Fuji sign here. So at least rule out the two commonly read options that you know, the topics that you know. I have read everything about pneumothorax, pneumoperitoneum, and nowhere did I read the Mount Fuji sign. So, at least this is how you rule out the options and increase your chances of getting your answer correct. Ruling out is very, very important. Okay, that's very, very important. Next one, I'm coming to all the questions. What is the diagnosis? Though the image is not the same, it was the image of femur, CT showing femur bone, but the image, femur bone looked very similar. Right, that's why I put this image for you guys. So remember here, look at the bone. How is the bone looking? The bone has very much cortical thickening here, which is irregular also, and the bone is dense, right? And there is some opening also in the bone which was shown. So basically telling you there is cloaca there. So sclerosis which is there, shabby appearing bone, right? This is how the normal cortex should be. Well defined like a line. This is the cortex which is thick, irregularly thickened, and there is an opening in the bone which is cloaca. This is chronic osteomyelitis. What was the other option, Prasanna? Was it osteomalacia? So I'll write it as the fourth option because I could not recollect it. So the answer definitely here has to be chronic osteomyelitis. So if you learn out of this question, chronic osteomyelitis has been asked in the previous AIIMS INI-CET exam also. There they had asked you identify which is sequestrum, which is cloaca, what is involucrum, right? So remember that this is just a twisted version of that. Directly they have given you the image and they've asked you to make a diagnosis. Right. So if it would have been osteosarcoma, remember sarcoma will have had a sun ray pattern of periosteal reaction. Ewing's has onion peel appearance, right? Osteomalacia will have the pseudofractures, the looser zones is what you would see. Gluteus, if you ever see the image of the onion peel periosteal reaction, ऐसा इतना dense ऐसा नहीं होता है. This is the cortex which has thickened. The onion peel periosteal reaction is if this is the bone surface. This is very, very subtle. The onion peel periosteal reaction, like multi-lamellated, is what you would see. Okay, multi-lamellated is what you would see. No, it was not the diphysis per se. And definitely it was not Ewing sarcoma. Okay, the proximal femur was involved there, and osteomyelitis can involve any part, right? Metaphysis se start, okay. Right, it was definitely the irregular shabby looking bone with the opening in the bone, that was chronic osteomyelitis. Okay, that was chronic osteomyelitis, right? Next one, true about CT. See, this is an example of a question where I tell you that if you know the answer to a question, right, you know that one option, I'm very sure that this is correct, and you do not know about the other options, you do not need to waste your time there and break your heads on that. Water has HU value of 0. I hope that at least all of you know this. The CT may HU values. The HU scale, remember, is like a number scale which has the 0, the positive end and the negative end. And we have discussed that what is given the HU value of 0 in CT, that is water. Whatever is more dense than water, that is bone, metal, soft tissues, will have a positive HU value. Whatever is less dense than water will have a negative HU value. So can you tell me that what have negative HU value? What substances have negative HU value? What substances have negative HU value? So, well, it means the same thing. Anterior end of rib, it basically means the same. Right, very good. It is air and fat which have negative HU value, so they appear dark on CT. So, water has 0 HU value is definitely correct. I'm pretty sure about that, though I do not know whether it uses filtered beam, unfiltered beam. What is the dose on the CT head exactly? I don't remember the number, but I definitely know that water is HU value 0, so I will mark that answer. CT is not the first investigation for gallstones. Remember, for gallstones, the investigation of choice is ultrasound. They are not calcified stones, majority of them. While for renal stones, you have CT, which is the investigation of choice, but not for gallstones. CT head dose, remember, it is starting from the top. It is 2, 8 and 10. CD head ka dose is 2, chest ka is 8 and abdomen pelvis ka is 10. So, CD head is 2 millisieverts, CD chest is 8 millisieverts and CD abdomen is 10 millisieverts, 2, 8, 10. Unfiltered X-ray beam is not used here. The concept here is when you get the X-ray from the X-ray tube, radiograph, CT scan, both use X-ray, so X-ray tube. The X-ray coming from the X-ray tube is the one which is not of the same energy. It is polychromatic, polyenergetic. Some X-rays which are coming out are low energy, some X-rays which are there are high energy. So when you want to take the image of the patient, it is the high energy X-rays which will penetrate and form the image. The low energy X-rays will have low penetration and they will stay in the body, and unnecessary radiation exposure is what is happening to the patient. They are not contributing to the image formation. That is why what do we use in X-ray or CT is, we use a filter. So remember the point that a filter is used to remove the low energy X-rays coming from the X-ray tube because they are adding to the radiation exposure. So remember, we are not using unfiltered X-ray beam, we are using a filter. Okay, we are using a filter. Okay? Is it clear with everyone? What is the doubt here? Yes? Mnemonics definitely याद आने वाले हैं, कोई बात नहीं, it's absolutely fine guys. 1, 2, 3, 4, 10 questions, 15 questions here and there, it's fine, it's okay. है ना? Yes? Remember, definitely the answer to your bone wala image is chronic osteomyelitis, whether you want to agree to it or don't want to agree to it. It is chronic osteomyelitis. It is not Ewing's. It is not Ewing's. Okay? Yeah. Contrast that can be given in patients of chronic kidney disease, again something that we have discussed in the radiology videos on PrepLadder. We have definitely discussed this, that you have CT contrast, you have MRI contrast and you have ultrasound contrast. What is the ultrasound contrast that we use? Those are the micro bubbles, right? We have discussed this in our revisions as well. है ना. So remember that micro bubbles, these are of sulfur hexafluoride gas, and these micro bubbles are excreted by the lung. They have the lung excretion, micro bubbles. While the iodinated contrast, be it ionic, non-ionic, is renal excretion, gadolinium is renal excretion. That is why we have to check the GFR, that is serum creatinine, before giving a gadolinium or iodinated contrast. So remember, in patients of chronic kidney disease, we can give ultrasound contrast, that is microbubbles, because it is excreted by the kidney. Okay, because it is excreted by the kidney. Okay. And we have also discussed how does the ultrasound contrast image look like. It is orange colored ultrasound image. Orange colored ultrasound image is a ultrasound contrast. Okay. Next one. Same image was asked in your exam, I believe. What is the diagnosis? Patella fracture, tibial condyle fracture, rheumatoid arthritis, or heme arthrosis? Yes. That's great, Darshan. That's great. So if you look at this image, this is how you had to pick this up. So this is the patella bone which you are seeing here overlapping the femur, and if you look at it very carefully, there is basically the fracture line here in the patella. So this bone that you are seeing here, this is the patella here, and through that you are seeing the fracture line. So remember, this is patella fracture. Okay, this is patella fracture. This was the same image that was given in the exam, right? The same image. Absolutely gluteus. I mean, they knew that अगर हम lateral X-ray दे देंगे तो वो तो बड़ा obvious हो जाएगा. So just to add the twist to it, right? They are given this image. Lateral में it would have been very clear. Okay, lateral में it would have been very clear. Okay. No, it is patella fracture only. That is what the answer is to this question. It is patella fracture. Okay. नहीं, without zoom करके भी दिख रहा था, right? You could see the fracture. If you see carefully, you can see the fracture even without zooming the image. See, if it would have been heme arthrosis, there would have been heme arthrosis like seen in hemophilia. There is condylar enlargement, there is significant intercondylar, the notch which is widened is what you would see, and the joint में बहुत ज़्यादा effusion होगा. Okay, though there is effusion in this radiograph also, but heme arthrosis will have significant joint widening, intercondylar notch will be widened. Okay, narrowing नहीं होता है, उसमें widening होता है, widening. Okay. Yes. चलो नेक्स्ट वाले पे चलें. Yeah, another one, right, where the options were confusing. What anatomic variation are you seeing in this CT? Okay. So anatomic variation seen in this CT is, many of you, I'm pretty sure, did think of it's a tracheal diverticulum, because trachea ke baaju mein you could see something air filled also, like something like this was seen. I had another image, probably the image got changed. Okay, so I forgot to put that image. So you had the trachea and you had adjacent to that another air filled structure. Remember that another air filled structure was basically esophagus. So this type of image was there. If you remember, the only change in the image here is adjacent to this you saw one more air filled structure here. That was the only difference, and this another air filled structure here was the esophagus. That's not your tracheal diverticulum, or that's not the double esophagus. Okay, this was the image there, this sort of image was there, though not the same image, I agree to that. Okay, and this was definitely there. So if you look, remember the image that was asked in the exam, there were these three arteries which was there, the vein was coming here, entire vein was here, and there were these three vessels, and one vessel was right there in front of the vertebra. Okay, one vessel. So will you agree the image was something like this as well, कि vertebra के आगे एक vessel दिख रहा था contrast containing, if and only if you focused on that and you moved beyond those air filled structures and you moved beyond tracheal diverticulum. Okay, so remember the answer here again is ARSA. Again, if you want to accept or don't accept, the answer is going to be ARSA here. This is going to be aberrant right subclavian artery. So when you see this four branches, 1, 2, 3 and 4. Remember, aberrant right subclavian artery. From where does normally the right subclavian artery come? The right subclavian artery comes from, it's a branch of the brachiocephalic trunk. Remember, the arch of aorta has three branches coming, A, B, C's. Remember A, B, C's? From the arch of aorta, you have the three branches, which is BCS, that is brachiocephalic trunk, carotid, and subclavian. The brachiocephalic tells you that it divides into the brachio, the subclavian, and the cephalic, that is carotid. So the right subclavian normally comes from the brachiocephalic, and the arch of aorta has three branches. What happens with aberrant right? You have right common carotid, left subclavian, and the last branch to come here is the right subclavian artery. The leftmost branch is the right subclavian. So from the left it comes to the right, and as it goes to the right, it goes behind the trachea and the esophagus. So remember, we have discussed in our radiology videos again that this causes posterior indentation on the esophagus. Aberrant right subclavian artery goes behind the esophagus and causes posterior indentation, while the left atrium causes anterior indentation. Okay, so this is aberrant right subclavian artery, which goes behind the trachea, esophagus, in front of the vertebra. This is going to be ARSA. ठीक है, ये ARSA है. It was not tracheal diverticulum. It was trachea, and the other airfill structure was esophagus. It was not tracheal diverticulum. It was ARSA, aberrant right subclavian artery. Okay, the answer there was aberrant right subclavian artery. Okay, aberrant right subclavian artery. Okay, clear with everyone? Of course, if they would have given you this image, this would have been very clear. Ki this is the arch of the aorta, and this is another artery going behind the, in front of the vertebra, behind the esophagus. This is aberrant right subclavian artery. But they did not give you that image. The image was something like this with two airfill structures given, and that's why the confusion of tracheal diverticulum coming in there. When you see a artery here which is in front of the vertebra, it is ARSA for sure. This is aberrant right subclavian artery. अरे esophagus का shape कैसे भी हो सकता है इशिता, depending on how much air it is containing. Here in this image you are not seeing the esophagus because it is collapsed. In a patient where the esophagus is distended containing some air, you would see the air in the esophagus. So esophagus is a collapsible structure. It might be completely collapsed, it might contain some air. Trachea will always be like this, black, distended with air. Okay, this is the normal arch of aorta. To the left side of the trachea, there was no right-sided aortic arch. Okay, right? नहीं, right aortic arch बिल्कुल भी नहीं है. Aortic arch वहाँ दिखाया ही नहीं गया था. Okay, aortic arch was not shown. ये normal, this is anatomical variant only. This is normal, like this is anatomical variant itself. Not all the patients will be symptomatic here. ठीक है? Clear with everyone? ठीक है? Right. Going to next one. This was a straightforward question. Please do not overthink here कि ये carcinoma esophagus है, कि ये achalasia है. This was a very straightforward one. That was basically the lower esophagus was showing the bird beak appearance, and the answer here was achalasia. Okay, the answer here was achalasia. Now remember that when it is when it is the lower esophageal sphincter which is contracted and the entire esophagus is dilated like this, it is achalasia. Carcinoma esophagus will be more irregular narrowing and more common in the mid-third of the esophagus, not at this lower esophageal sphincter like you are seeing. Right? Here the entire esophagus is dilated, right? The sigmoid esophagus is what it is called. It is achalasia. Okay, it is achalasia. ठीक है? Clear with everyone? Achalasia is known to cause weight loss. Achalasia के triad में आता है dysphagia, there is weight loss, there is regurgitation, there is weight loss in achalasia also. Okay, there is weight loss in achalasia also. ठीक है? Next one. This was given, actually this was like the surgery question, EDH was given, so that's what I wanted to ask here. Show here basically that EDH is what has this biconvex shape. This was EDH and the management was asked. Okay, EDH and management was asked. Mannitol क्यों दोगे इसमें? Why mannitol? And now I cannot get the same image for all the images, guys. The images are going to be here and there. It was like a similar image that you had. Yes. The pupil, right, the pupil में दिया हुआ था, pupil was dilated, pupil non-reactive, something like that was given in the question, right? So when the pupil is affected, surgical evacuation is needed in that case. Okay, surgery is recommended. So as soon as possible, surgery should be done if the GCS is less than 10 and the pupil or the pupil is showing unequal size or there's dilated pupil. Okay, so remember that. Surgery hona chahiye answer. The surgery faculty will give you an authentic answer for that. According to me, it should be surgical evacuation. Okay, the surgery should be done. Next one, there was the chest x-ray image which was there. Right, chest x-ray which was there. Though the image you might have found a bit difficult, but remember that when the images are difficult, your options give you a clue to what exactly the image they are trying to show in the image. है ना? So this is basically, what is this image, guys? Yeah, this is pericardial effusion. Okay, this is pericardial effusion. If you look at the options which were there in the question, what were the options there? The question said that the patient had fever for 1 month, then there was pain, and now there is shortness of breath also, there is dyspnea which is there, and the question was which of these is false about the condition, right? The false statement will be loud S1. So pericardial effusion can progress to like tamponade like condition when it accumulates very fast, the speed is fast. So, and you know that in cardiac tamponade, you read about Beck's triad there, that is muffled heart sounds. Because of the fluid, you will not hear the sounds very well. So, remember loud S1. ठीक है, loud S1 इसमें नहीं होगा, इसमें muffled heart sounds होता है. बाकी options जो थे वो सही थे कि pericardiocentesis लग सकता है emergency में. If it is causing collapse of the right atrium or the right ventricle, right, again emergency urgent treatment might be required, and it can show pulsus paradoxus. Pulsus paradoxus can be present. So these were the options which are correct. Loud S1, you know that here in tamponade the heart sounds are muffled. Okay, the heart sounds are muffled, right? So okay. So these were the 11 questions which were direct radiology or radiology integrated questions. So you can see that this was an integrated question, this was an integrated question asking you the management. The rest of them were direct questions. So radiology definitely had more images this time and more conceptual tricky images this time. Right. So remember, INI-CET definitely is testing you a lot on your concepts, the presence of mind, the logical thinking and the logical guessing of the answers. It definitely tests you on that, right? So I hope, chalo badhiya. Overall, 9 on 11 is very good score, guys. If you have got 9 on 11, that's really good depending on the questions that you have got. Okay. और दूसरा जो है, so yes, the paper was a moderate one, like not easy, not very easy and not very difficult also. It was a very doable paper, like with a lot of the topics which are the frequently asked topics, just that the options were confusing, the topics were asked in a bit depth, few topics, otherwise it was average is what I would say. Okay? Yes, BPR, Medicoma, yes. Okay? So that was about the radiology recall, guys, and a quick recall of that. You would have the recall of the next or the rest of the subjects coming up on the PrepLadder YouTube channel. You would see the notifications in the YouTube channel itself. So make sure you are subscribed to the PrepLadder YouTube channel so that you do not miss on any of the important sessions that we keep doing on this YouTube channel. All right. Thank you so much, everyone, for joining in, and goodbye. Take care and keep studying, keep revising and keep winning. Thank you.